Hospitals are used to a winter surge, but this year they're bracing for a tsunami.
It's the first day of winter and hospitals are already reaching capacity, while COVID continues to force the cancellation of surgeries. Here's our health correspondent, Lucy Warhurst.
Christchurch resident Richard Stevens is the latest casualty of COVID. Not the virus itself, but the knock-on effect. He'd been due to undergo surgery for a hiatus hernia today.
I got a phone call about 2 o'clock yesterday afternoon to be advised that surgery had been cancelled.
And it's not the first time. It happened in April too.
I was actually gowned up waiting to go into theatre, and the surgeon came in and told me that surgery had been cancelled due to a lack of beds.
It's left him dumbfounded, depressed and in a lot of pain. Christchurch Hospital revealed yesterday it was cancelling planned surgeries after it reached 112% capacity. Official information released to Newshub by Canterbury DHB shows that even without a winter illness outbreak, they'd be 90 resourced beds short per day. With a small outbreak, they'd be 110 beds short. And in the event of a large outbreak, they would be upwards of 120 beds short.
Most years we talk about a winter surge. This year it's starting to look more like a winter tsunami, and it is incredibly concerning.
Hawke's Bay DHB is also struggling with so-called fluorona, saying it's overstretched by the number of flu and coronavirus patients. Wellington ED is warning of longer wait times due to higher volumes. And at Auckland's Middlemore ED, presentations are 7% up on last year.
Every winter it is a strain on the healthcare system. This winter is definitely more difficult for us. We see people falling sick with COVID, not only people that need to come to hospital, but also our staff.
Dr Anthony Jordan says prevention is better than cure. So today a campaign kicks off across Northland and Auckland, offering flu and COVID vaccines at winter sports events.
At sports events at weekends, it's quite convenient for them to get vaccinated then.
The goal, to keep people out of hospital.
Kia ora, Lucy. So how do hospitals plan to cope as winter illnesses hit?
Well, Mike, official information released to Newshub on winter preparations show that Middlemore plans to minimise admissions, while similarly Christchurch plans to reduce admissions, shorten stays and postpone surgeries. And on day one of winter, we're already seeing that happening. But this is how effective it has been. Yesterday, they were at 112% capacity. Today, this afternoon, down to 93%. That's just above the national average of 90%. Good for the hospital, but not for the patients waiting for surgery.
Health correspondent Lucy Warhurst, Tēnā koe.